time. I need a doctor. Call me a doctor.
Okay, so based on these symptoms you gave us, we've come to the conclusion that you have biliary colic, which is a form of gallbladder stones.
Okay, I don't really know what that means. Could you explain it to me and maybe tell me what I can do about it?
Biliary colic is a type of gallstones. Gallstones are hard, pebble-like deposits that form inside the gallbladder. Gallstones may be as small as a grain of sand or as large as a golf ball.
Symptoms that may occur include pain in the right upper or middle upper abdomen, may be constant, may be sharp, cramping, or dull, may spread to the back or below the right shoulder blade, fever, yellowing of the skin and white of the eyes, jaundice. Other symptoms that may occur with this disease include clay-colored stools, nausea, and vomiting.
Gallstones are more common in women than men. They can also run in the family.
The most common symptom of gallstones is biliary colic. Biliary colic is a very specific type of pain, occurring as the primary or only symptom in 80% of people with gallstones who develop symptoms. Biliary colic occurs when the extrahepatic duct, cystic hepatic duct, or common bile duct are suddenly blocked by a gallstone.
The ultrasound. Abdominal ultrasound is an imaging procedure used to examine the internal organs of the abdomen, including the liver, gallbladder, spleen, pancreas, and kidneys. There is no ionizing radiation exposure with this test. An ultrasound machine creates images that allow various organs in the body to be examined. The machine sends a high-frequency sound wave that reflects off body structures to create a picture.
Before the procedure, you should wear comfortable, loose-fitting clothing for your ultrasound exam. You may need to remove all clothing and jewelry in the area to be examined. You may be asked to wear a gown during the procedure. Preparations depend on the type of ultrasound you are having. For a study of the liver, gallbladder, spleen, and pancreas, you may be asked to eat a fat-free meal on the evening before the test and then to avoid eating for 8 to 12 hours before the test.
Procedure. You will be lying down for the procedure. A clear water-based conducting gel is applied to the skin over the abdomen. This helps with the transmitting of the sound waves. A handheld probe called the transducer is then moved over the abdomen. The procedure usually takes less than 30 minutes. Usually, patients are asked not to eat or drink for several hours before the examination. This is a little discomfort. The conducting gel may be slightly cold and wet.
The first image is a negative image of an ultrasound showing that there are no gallstones in the gallbladder, and the second image is a positive result of an ultrasound showing that there is a gallstone in the gallbladder.
One type of treatment is surgery. Here's a video that explains about gallbladder surgery.
Removal of the gallbladder, called cholecystectomy, is usually performed when there is evidence of gallstones or inflammation of the gallbladder. Symptoms of gallbladder disease, usually consisting of intermittent right upper abdominal pain, most commonly occur when gallstones temporarily block one of two ducts that carry bile from the gallbladder to the intestine. If the stones do not pass, the gallbladder may become swollen, inflamed, or infected, which may lead to more severe symptoms such as nausea, vomiting, and fever. Newer laparoscopic techniques require only keyhole incisions, and the recovery period is much shorter. Before the procedure, an intravenous line will be started, and you may be given a sedative to help you relax. Laparoscopic cholecystectomy is done under general anesthesia, which will put you to sleep for the duration of the operation. This will relax the muscles of the abdominal wall, allowing your surgeon room to work. A breathing tube will be temporarily inserted through your mouth and into your throat to help you breathe during the operation. You may also have an orogastric tube placed through your mouth and into your stomach to help drain fluids produced there. Most cases take between 30 and 60 minutes to perform. To gain access to your gallbladder and surrounding structures, your surgeon will use sharp instruments called trocars to create a series of small holes or ports through your abdominal wall. One of these ports is usually located at the navel or umbilicus. Carbon dioxide gas is then pumped through the umbilical port to puff up your abdomen so its contents can be viewed more easily. Next, your surgeon will insert the laparoscope through the umbilical port. Images from its camera are projected onto a video monitor in the operating room. Using other instruments passed through the various ports, your surgeon will grasp the gallbladder, clip off its main artery and duct, drop it into a specimen bag, and remove it through one of the ports. Before removing the laparoscope, your surgeon will take one final look around for areas of bleeding or other damage. When the laparoscope is removed, a port valve is left in place briefly to allow all the carbon dioxide to escape from the abdomen. Finally, the keyhole incisions are closed with sutures or staples and covered with bandages. After the surgery, your breathing and orogastric tubes will be removed, and you will be taken to the recovery area for monitoring. You will be given pain medication as needed and will progress slowly from a liquid to a soft to a solid diet. Your intravenous lines will be removed once your gastrointestinal system recovers. Most elective cholecystectomy patients can leave the hospital within 24 hours. Patients with infected gallbladders may need to stay 1 or 2 more days.
I'm about to lose my mind. You've been gone for so long. I'm running out of time. I need a doctor. Call me a doctor. I need a doctor to bring